factors affecting the periapical extrusion of debris, irrigating solution, and microorganisms during chemo-mechanical preparation of root canal system. From the literature, myself. Myself, Dr. Sachin Metkari from Nair Hospital Dental College, Mumbai, India. I'm affiliated to Maharashtra University of Health Sciences, Maharashtra, India. What is periapical extrusion? Where and how? During chemo-mechanical preparation, there is infected debris and microorganisms extruded, and during irrigation, there is extrusion of these materials beyond apex, causing severe pain and swelling to the patient. These are some cases where you find there is an extrusion affecting patient, sleepless night, and severe pain that leads to flare-up in cases. Periapical expulsion, balance and imbalance. When there is non-vital tooth in the oral cavity, the patient seems to be okay, but when you start with a root canal and starting with the cleaning and shaping with the instrument, there is an abrupt virulence effect there in the periapical lesion, which causes increase in the microorganism because of the expulsion of these debris during instrumentation. So we have to know that what is the pathophysiology behind this phenomenon. Primarily, this infection is characterized by mixed communities predominated by anaerobic bacteria. There is a mobilization and concentration of the defense component at the periapical infected root end. So generally, there is no spread of infection in the periapical region till microbial growth outburst. So there is equilibrium between the microbial aggression and host defense. But once you disrupt that microbial flora by extruding beyond the apex, there is a chance of flare-up. This is the instrumentation in the periapical region causing severe extrusion to the apex when you start with the instrumentation. So there will be disbalance in the periapex. Chemo-mechanical preparation lead to periapical extrusion, leading to acute periapical inflammation, leads to flare-up. Now, what is a flare-up? Flare-up is defined as the occurrence of severe pain and swelling following the endodontic treatment appointment, requiring an unscheduled visit and active treatment. Despite correct access opening of a root canal and strict control over the working length, still there is an incidence of flare-up during root canal treatment that is about 1.4 to 16%. The causes may be the extrusion of these materials. Literature reported that non-contaminated as well as contaminated dentine and pulpal tissue can trigger this inflammatory reaction when forced periapically. But now, this flare-up, what will this do? This causes severe immunological reaction, causing vasodilatation, vascular permeability increasing, and there is activation of the chemical mediators. Activation of the kinin and clotting system that leads to exudation and edema formation, leading to swelling in that region. Increase in the tissue hydrostatic pressure that gives severe pain to the patient because of the compression of the nerve ending. It also causes immunological reaction there, causing bacterial endocarditis in some patients as well as a prenapsis in some immunocompromised patients. Chapman was the first person to report the extrusion of infected debris in the root canal system beyond the apex. Selzer and other authors are also there that shows there is an antigen antibody reaction that trigger the complement cascade and inflammatory process. Many studies investigated the apical extrusion with a different in system and methodology during chemo-mechanical preparation. All studies show that apical extrusion is inevitable during cleaning and shaping of root canal system. Literature lacks the studies that assess all these factors together. Moreover, there is always limitation of the sample size in individual study. So this literature, review of literature, gives the combined combines results. So aim of my study to discuss the etiological and contributing factors that influence the apical extrusion during chemo-mechanical preparation. Search for the articles were conducted in PubMed, Medline, and Google Scholar and Web of Sciences with the keywords of apical extrusion in endodontics, periapical extrusion. There are more than 300 articles displayed. 75 articles were selected for discussion. All influencing factors responsible for expulsion were identified, compiled, and presented here. Inclusion criteria for these articles are unique instrumentation technique, innovative irrigation protocol, comparing the different instrumentation, compare different irrigation technique, include different irrigating solution and concentration of these irrigants were included. Exclusion criteria, retreatment cases were excluded. A refutation of the methods, the studies are excluded from these studies. And alike causing factors are also excluded from this study. Methodology and experimental design. The first study by Mayers and Montgomery used this apparatus, and we also done study using this innovative apparatus, where tooth is hanging in the vial with a rubber dam sheet and side-vented needle is there. Classification of regular expulsion as according to the precipitation factors, they are classified as related to tooth, instrument, as well as irrigation. Tooth-related influence factors are assessing the apical patency, periapical expulsion and disruption of the apical constriction, influence of root length, vitality of tooth, root curvature, cervical pre-flaring, instrument-related contributing or precipitating factors are type of instrumentation, manual or engine-driven, different rotary instrumentation, rotary versus reciprocating instrumentation, different reciprocating instrumentation, effect of different pitch of instrument in relation to apical expulsion will also be included. The effect of simultaneous instrumentation and irrigation, that like a self-adjusting file. Irrigation-related influencing factors are irrigation protocol and irrigation system, different types of irrigation devices, different irrigating solutions. Advantage of this classification is to identify the exact cause of exclusion, whether it is tooth, instrument, or irrigation related. Further definite factor can be also recognized. When the exclusion factor is classified, then corrective measure can be implemented. There will be help in prevention of the expulsion periapical region, so no pain and swelling to the patient. Flare can be avoided and preventive measure can be applied. This will help in treatment prediction and positive acceptance of a patient for the treatment. This classification I have put for the Copyright Office in India, and soon it will be verified. It is in last stage of acceptance. Tooth-related influencing factor for periapical expulsions are the assessing the apical patency on periapical expulsion, The smallest instrument is used to assess the patency of the canal by negotiating till the major diameter of the canal. This may be associated with the periapical expulsion of debris. These are referred by the author Borges and other authors like Indian research. Periapical expulsion and the disruption of the periapical constriction. There is a disruption in the apical constriction because of the pathology or root resorption that also affect the extrusion of debris, irrigants, and bacteria. Periapical expulsion increase with the increase in diameter of the apical constriction, obviously. So these are also the influence of the root length in the periapical expulsion. There is also observation that as the length of the root canal increase, the amount of the debris will also increase. So the brilliant also shows the same study. Nair and Montgomery also explain this same phenomenon. Vitality of tooth. If tooth is vital, there is less expulsion than the non-vital tooth because of the tissue present in the lateral canals that will prevent extrusion of some debris. Root curvature in Bruce Seber's study, when their simulated tooth were operated for the extrusion, they showed that there is a more extrusion in the straight canal than the curved one. Cervical proliferating during root canal also affect the extrusion. If you do the proliferating before the root canal preparation, then there is a less debris pushing out of the canal. That result in less packing of debris periapically. This is also observed by Borges et al. Manual versus engine-driven instrumentation. There are so many studies shown that manual instrumentation always have a more extrusion than engine-driven instrumentation. Different rotary instrumentation in that rotaper, profile, and hero shaper were investigated for this. This showed that the rotaper showed more debris than the other instruments, because that show that the progressive taper and simultaneous cutting efficiency of the protaper gives more expulsion periapically. Pocack also showed that the protaper universal showed more expulsion compared to the protaper next, that is a different generation of the rotary system. They have concluded that the protaper next result in less debris because it has a different center of mass and center of rotation. Offset design will affect the preparation, as this offset design with a rectangular cross-section design produces mechanical wave of motion that travel along the active length of the file, which minimizes the engagement between the file and dentin. It also enhances the debris pushing out of the canal in coronal direction. That's why protaper next use less debris compared to the universal protaper. Some similar studies were observed for the rotary instrumentation. Here we have studied heat-treated nitrile file, that is a flexagon that is similar to endo, that shows minimal expulsion of debris and irrigating solution irrespective of the irrigation method used. Heat-treated nitrile files have superior flexibility and resistance to cyclic fatigue, shows less aggressive cutting efficiency. Also, there is a variable pitch and increased helical angle support the removal of the debris in coronal direction. That's why less debris and irrigating solution. Rotary and reciprocating instrumentation were compared. In some studies shows the rotary instrumentation have more debris than reciprocating and vice versa. that different instrumentation methods were used, and there is a different file numbers also affect that result. Different angle of reciprocation affect the apical expulsion, like if more clockwise rotation than counterclockwise rotation, then there is a extrusion of extrusion will be more in the periapical region. There will be different, if there is a different pH of instrument, then it also affect the expulsion. Short piece result in less amount of the apical expulsion. The effect of self-adjusting file on expulsion, it shows less extrusion because of the simultaneous instrumentation as well as irrigation. Irrigation affect the influencing factors like irrigation protocol and irrigation system as per given by Halsman. Mitchell also compared the 27 gauge irrigation needle with an endovac, and it comes that endovac irrigation prevent the irrigation and prevent the extrusion and effective than the side ventilated needle. So open-ended needle cause more expulsion. Effect of different irrigation solution when 2% chlorhexidine, 5.25% of hypochlorite and 2.5% sodium hypochlorite were used, then 5.25% sodium hypochlorite more amount of the expulsion compared to the other irrigant. Higher concentration of the sodium hypochlorite will better dissolve the organic tissue. That's why the results. How to avoid expulsion now? Instrumentation technique, use of alternative technique. Instead of step back technique, like you can use crown down technique. Reciprocating and rotating instrumentation, you have to choose accordingly. Negative apical pressure irrigation method should be used, like a endovac irrigation system or self-adjusting file irrigation protocol. Side-vented needle are better than the open-ended needle irrigation. Gentle irrigation is also required and flow should be controlled, that is 1 to 2 ml per minute. Consider the passive ultrasonic irrigation also. Working length determination should be confirmed. There should not be reframing frequently and adjusting of working length. General preventive tips for the prevention of the extrusion are: always recognize the high risk cases like apical foramen, mature teeth apical resorption, over enlarged apical cases. It should be more conservative preparation in that cases. General tips: accurate working length, proper instrumentation, non-cutting tip of the instrumentation were used. There should not be any canal transportation, or you can use heat-treated nitrile. They are better for the prevention of the extrusion. Conclusion and clinical significance. Literature reports show that all instrumentation and irrigation technique have a extrusion. Among the hand instrumentation, step-back technique shows more. Rotary instrumentation produce less expulsion than hand. Cervical preflaring should be used. Endovac-like system should be used. Final conclusion: there is a humoral and self-mediated immunological reactions are there when you use all these instrumentation causing expulsion. So be careful. Several factors responsible for the periapical expulsion are root length, root curvature, cervical preflaring, destruction of the periapical constriction, irrigation system, different instrumentation system, and so on. They are broadly classified as tooth, instrument, or irrigation related. Addressing the influencing factor cause of expulsion can be identified. Periapical expulsion and the flare-up can be avoided with a proper precaution. These are my references. This is my university and this is my hospital in India. Thank you so much.